I'm Dr. Khoo Kei Siong. I'm a medical oncologist practicing in the Parkway Cancer Centre, where I'm also the Deputy Medical Director and a Senior Consultant in Medical Oncology. The infrastructure of cancer care in Singapore can be roughly divided into both the public facilities and the private facilities. We have two major multidisciplinary cancer centres in Singapore with the whole range of expertise ranging from surgical to medical to radiation and palliative care, all under one roof. There are also other cancer centers in the private setting of a smaller scale. Collectively, they look after all the local residents as well as the many patients from the region. Well, Singapore has enjoyed the availability of many state-of-the-art facilities and equipments as well as medical expertise. Majority of the doctors are trained both locally as well as in overseas, and many tertiary centers in overseas with specific skills and expertise to offer. So we have nearly 100 medical oncologists. We have surgeons who specializes in surgical oncology and specific areas of surgical oncology such as breast cancer, colorectal cancer, urological cancer, gynecological cancers, and so on. It's always in a work in progress. I think we have enough at the moment to look after most of our patients. We are continue to train more in all areas of specialties. It's with more doctors, we are also engaging them in not just clinical care, but also research, particularly in the two major cancer centers where there's a lot of research that's going on looking at various aspects of cancer, both in general as well as specifically to our local situations. Singapore has an active palliative care service, both in cancer centers as well as in the private setting. In two major cancer centers, they have departments of palliative medicine, providing care primarily to cancer patients, but also to other patients with chronic incurable diseases. There are a number of VWOs, voluntary welfare organizations, charities that provide palliative care, both institutionalized as well as home care at very low cost to the patients. The basic healthcare funding is by a compulsory saving accounts for all residents. We call it MediSave, as well as an insurance component, what we call MediShield Life. And together, they can be used to cover both acute and chronic care, including cancer care, of course. Take chemotherapy, for example. With MediSave and MediShield Life, a patient is able to get reimbursed up to 3,000 to nearly 4,000 Singapore dollars per month for outpatient cancer chemotherapy treatment. So, and with this funding, it has gone a long way in making many of the state-of-the-art treatment accessible to the majority of the patients. Of course, there are also patients who are not able to afford some of these treatments, where there are other safety nets in place. We call it the MediFund, where there's an extra funding specifically for patients who sort of slip through the net, or the first two net, and are able to get the treatment still if indication exists. Singapore has a vibrant private healthcare practice. There are, at the last count, there are about 5 or 6 major private hospitals where most of the specialists are very experienced physicians. They look after some of the local patients and a lot of the patients from the region. It has helped to propel Singapore into a regional medical hub in more ways than one. Breast cancer screening, or cancer screening in general, has always been the focus of the government. We have a health promotion board that goes around to educate the public about the importance of screening among all the other chronic diseases. Take breast cancer, for example. We have a program called Breast Screen Singapore, where letters of invitations are sent to residents who meet the criteria for screening. In Singapore, any woman who is 40 years and above are recommended to go for annual mammogram screening, and when they hit 50, it will be every other year. So Breast Screen Singapore invites these women to come forward for screening in one of the primary healthcare facilities near to their home. And the films will be centrally read, and then anyone that's been flagged to have an abnormality who needs further evaluation will be, we have a letter written to them for recall. Complement to that, it's about public education. So HPV, Health Promotion Board, together with the other charitable organizations such as Breast Cancer Foundation, Singapore Cancer Society, and through the effort of the institutions, the cancer centers, the private healthcare facilities, they go all out to educate the patients, to raise the awareness about this potentially treatable and curable disease. And we have seen more patients or more women coming forward for screening as a result. Of course, there's still a lot of work to be done. We are still not seeing all women coming forward. We hope that one day the number will reach everyone. Well, my association with ACOS has gone back many, many years, and I must say that I'm not totally familiar with the Indian situation, but you have a very different problem from Singapore. I mean, Singapore is a very small country compared to you. You have a large, huge populations, in rural areas included, and to provide adequate health care to all women who needs them is already a huge challenge. Yeah.